Well, hi, everybody. Bill Kelly, chair of chess games, and we have the Chess Game Hub. Over 10 active games made possible through our amazing chess staff. We have Rob Rubito, Christina Lorenzo, Sean Davies, Abby Perillo, and you can play these games 24 hours a day. If you play between June 17th and June 24th, just play, you are automatically entered to win free registration to Chess 2021 Orlando or Chess Italy in February 2022. And also, we're going to recognize the top scores as well with a specific game, which is our Beat COVID-19 game. If you're the top scorer this week, we're going to announce you and show your picture June 24th. To make it interesting and more of a challenge, we have brought in a wonderful expert, Stefano Nava, Bologna University, mechanical ventilation expert, tons of experience, unfortunately, with COVID and a lot of general pulmonary expertise. Stefano, welcome.
Well, okay, good night now, because it's 10 p.m. now in Italy. So please, if you want to start, I'm excited to play. It is the first time in my life, so forgive me if I'm gonna make a lot of mistakes. First of all, because it's the first time, as I said. Second, because, as I said, here is 10:15 p.m. and I'm tired after a tough day dealing with only COVID patient in the last 16 months and in the last 12 hours, I say.
All right. Well, thank you for joining us. Even when you're tired, you are still the best. And we're going to show that here in just a second.
No.
Why don't we pull up our game? All right, Stefano. So 76-year-old man. He's got coronary artery disease and asthma, has COVID-19 infection, heart disease, his age, or asthma. What do you think? You can talk through this.
The study were not convincing, but for sure asthma is not one of the major predictor of poor outcome. True that age is a predictor of mortality, but it's also true that coronary artery disease, at least in my view, is a very important variable involved in mortality.
And we've shown our answer, much like COVID itself. You know, these questions seem awfully tricky. All right, here's that matching thing we can do. Easy way to get points between questions.
Genius, brilliant. So,
see, there you go, Dr. Nava.
I gain more points.
All right, male, 58. He's got bad diabetes and is intubated. Has bilateral infiltrates. Let's see, a P to F ratio of 160. ARDS protocol modified for a tidal volume of 9 mils per kg. APRV, ARDS lung protection. Dr. Nava, what do you think?
I would go for IRDS network protocol.
And you, especially those early days of COVID, you know, we were working without a lot of information. And yeah, maybe you got to rely on the proven general ARDS and ICU therapy. So let's see, Christina, is that correct? All right.
Great.
Let's keep going. Let's keep going. More matching. We don't need the matching points because we have Dr. Nava, but we'll take the matching points as well.
Do any better than I'm doing. So what I mean is that, I mean, in this question was interesting because it comes back to the good old days when we started to deal with COVID. So we were not aware of all the pathophysiology behind this disease. We didn't know about the different clusters of physiology in these patients. So I think it makes sense that using what was established and what is still established, I would say, for most of the patients with COVID-19 infection and severe acute respiratory failure.
All right, and we've got some rewards. Again, you get positive feedback, a lot of game theory involved in these exams, positive reinforcement for all your learning. And it's about tracheostomy in patients with respiratory failure and COVID-19.
I was thinking about negative pressure room, but I need to be very honest. In our hospital, that is 1,200, we only got 12 negative pressure rooms. That means that after the first 12 hours of outbreak, these rooms were all full. But once more, in real life, we did C. In theory, answer number B is probably the best option.
We're going to head back to our program, but any advice for players who try to come on with this COVID game over the next week?
Yeah, I think first of all, you need to be relaxed. I think second, you don't need to be tired. You need to do it early in the morning when you're not. But I mean, I don't think I like the game because it's not a right or wrong game. This one, it's not like an examination. If you want to win a prize, it is clear that you want to get the highest number of right question. But on the other side, you need also, maybe this game are also meant to discuss what is your real life experience. Because as I said, in most of the case, there is not the right question and the wrong question.
Well, Dr. Nava, thanks so much for joining us so late over in Italy. And I can't
I have to say that it was fun. First time in my life, I think it was fun. Please study more than I did.
And everyone watching at home, come on to the Chess Game Hub, play Defeat COVID-19, see how you do. You get a prize potential for playing. We're going to recognize the high score right up there with my friend, Dr. Nava.
Show that you are the best in the world and join us for the Italy chess meeting very early. We welcome you virtually in my country. Ciao.
So come join the hub. And now we're going to go back to our program.